Hello, I'm Dr. Tolliver. I'm one of the pediatric transplant hepatologists and gastroenterologists at Riley Hospital for Children. And today I'll be talking about the healthy liver, the do's and don'ts to keep your liver healthy in regards to what we typically counsel pediatric patients and their families on when we're talking about liver health, especially in the setting of autoimmune hepatitis. So I appreciate and thank the Autoimmune Hepatitis Association for inviting Dr. Josh Farparn and myself here today to talk about these pediatric topics, and we're excited to get involved to help others learn a little bit more about pediatric autoimmune hepatitis. So I will get started. I have no disclosures pertaining to this lecture. These are just the objectives for my talk. I know Dr. Josh Farparn reviewed kind of the outcomes in pediatric autoimmune hepatitis. This lecture is focused a little bit on education we provide in the setting of having a chronic liver disease in general, but also as it pertains to autoimmune hepatitis as a chronic liver disease in our pediatric patients, and just some general tips that are good for overall liver health. So we'll talk about why that's important. We'll talk about herbal and dietary supplements. Are they helpful or harmful, since we typically get asked about the use of those in the setting of liver disease as well. And then a little bit about food fat in the liver, good and bad foods for the liver, and steatotic liver disease, or previously known as fatty liver disease. And then adherence and why taking medications is important in every age, but really specific to the pediatric population. So just a little bit about me to start. So I'm originally from Kentucky, moved a little bit around during medical training, but ended up in Indiana, and now have been here for a little over 5 years. I am a pediatrician, a gastroenterologist, and a transplant hepatologist. So yes, I liked a lot of school and training to get where I am, but really love my job and what I do. Some interests, because I am from Kentucky, I'm a big UK fan. I like to travel, really like music and cooking, and fun fact, was just married 2 weeks ago today, so recently married. And then my interests for my job and as a physician and research would be pediatric liver disease, specifically those liver diseases that cause high bilirubins in kids, and then autoimmune hepatitis and PSC, some of our autoimmune liver diseases, biliary atresia, and then I'm involved in some research studies on pediatric acute liver failure as well as biliary atresia. And then I have a special interest as well in pediatric liver cancers and tumors. So on to our topics of discussion today. So liver health, why is that important? Well, your liver has a lot of functions. I always like to say it's the most important organ in the body, but I may be a little bit partial. But your liver does a lot of things for you. It produces bile, cholesterol, and other products that help kind of transport goods and wastes around your body. It also produces or synthesizes a lot of essential factors that are used in blood clotting, nutrients for the body, other necessary chemicals for the body to perform all of its functions. It also is the detox place for your body, and so the liver detoxifies and takes out the toxins of your body, processes chemical wastes, including things like alcohol, medications. A lot of them are metabolized in the liver, and then just a lot of toxins in general that your body produces during all these chemical processes. Your liver is able to help get out of the body. Your liver also is a place for energy storage, and it stores energy in the form of glycogen, which is a type of starch. And then your liver recycles and disposes of red blood cells and some proteins in your body to help things moving along. So your liver is very important for how your body functions and a lot of things that go on in your body. So your liver health is very important. And so in the setting of autoimmune hepatitis or chronic liver disease, what can we do to promote liver health and prevent or limit liver inflammation? Because liver health is very important. And so a goal of treatment of autoimmune hepatitis, as multiple people have talked about today, is to control inflammation and to prevent liver scarring. And so are there other things we can do to help that from a liver health perspective? And so one of the questions we get asked a lot, I'm sure they do as adult hepatologists as well, is are there any herbal medications or dietary supplements that I can use in my child in order to help their liver better work or help decrease inflammation in the liver, or as a lot of products are advertised as help to detox my liver? And so we'll get into a little bit about herbal and dietary supplements. You may hear me refer to them as HDS in part of this presentation, and that's that's just an acronym for herbal and dietary supplements. So are they helpful or harmful to our liver health? So in order to know if they're helpful or harmful, we need to know a little bit of background about herbal and dietary supplements. So those are considered a product taken by mouth that contains a dietary ingredient intended to supplement a diet. And herbal and dietary supplements are regulated by the FDA, but actually not regulated as a drug. They are regulated as a food, which is important to know because drugs are very strictly regulated by the FDA. Foods are not as strictly regulated by the FDA. So it's important to know that the herbal and dietary supplements are regulated as a food, which means that manufacturers of these supplements only have to attest to safety of an herbal or dietary supplement. They do not actually have to prove its safety. Unlike when drugs are regulated by the FDA, those go through multiple clinical trials, first off, which is proving safety and safety and tolerability in phase 1 clinical trials of a drug before you can go on to prove how effective it is for a disease in multiple subsequent clinical trials. So drugs are highly regulated, have to be proven to be safe and effective, but foods and thus herbal and dietary supplements do not have to be proven to be safe and effective. Companies cannot say an herbal supplement cures a disease, but they can give what we call a structure and function claim that helps them infer what they're trying to get across is how their supplement should be used and what's it used for. So they can't say it cures a disease, but they can infer that it may help a disease. So those are just some of the nuances of herbal and dietary supplements and how manufacturers use those targeted towards patients. So there's a long history of use of herbal plants, dietary supplements, especially ancient Chinese and Egyptian papyrus writings describe medicinal uses for plants as early as 3000 BC. So we've been using plants and herbs for a long time. And one of the studies from the U.S. Drug and Herbal Office shows that about 40% of the U.S. population currently uses herbal or dietary supplements as alternative therapies. So there are a lot of people out there using HDS or herbal and dietary supplements. You know, that's millions of people. And so it's good to know what are in those dietary supplements. And the U.S. Drug-Induced Liver Injury Network, so we call it the DILI Network, Drug-Induced Liver Injury Network, actually wanted to look at and see are what companies describing in their products actually in their products. And so they have a study where they enroll patients who are known to have drug-induced liver injury, meaning a drug or medication that caused liver injury. And then they looked at these drugs that people were taking and looked at their labels. And then they studied through some scientific testing called mass spectrometry and high-performance liquid chromatography, very fancy terms. They studied what was actually in these herbal and dietary supplements. And actually they found 51% of the products, the small amount of products they studied, were mislabeled. They did not have all of the ingredients placed on the label. And so for us as liver doctors and in general physicians, makes us a little nervous about what you're actually intaking into your body if you're taking an herbal or dietary supplement. And the most common ones that did not match their label, the categories were appearance enhancement medications, sexual performance medications, weight loss products. Those were seen to be the most commonly mislabeled, meaning they had substances in them that were not on the label. And so all of this mislabeling just underscores the need for more stringent monitoring of these herbal and dietary supplements, and also outlines that, you know, you may be taking something in one of these medications that you don't really realize you're taking or giving to your child. So it's important to know what we're taking into our bodies. So are there instances that we think that some of these herbal and dietary supplements can be helpful? Obviously, this is a small table. There are a lot of herbal and dietary supplements out there. I use this table just to highlight that we have studied some of these herbal and dietary medications in the liver world, mainly in the setting of NASH, which is now newly called MASH, but it is a fatty liver disease or a steatotic liver disease that causes inflammation. I've also studied some of these supplements in alcoholic liver disease, and then the liver cancer, hepatocellular carcinoma, and then hepatitis C. So the substances or the herbal and dietary medications are listed on the left. One that I feel like I get asked about relatively often is milk thistle, one of the herbal and dietary medications that has been studied in some liver diseases, specifically fatty liver diseases, is an antioxidant, and it has actually been through a few clinical trials. It had a phase 1 clinical trial which determined it was safe to take when you're taking only milk thistle, not with other additives. And then there was a phase 2 trial, which is when we actually use it to prove if it's effective in a disease, that really didn't show a significant or a statistically significant improvement in fatty liver disease, but it did show some improvement in liver enzymes in alcoholic liver disease. So obviously you'll notice on this list there are no listed studies for autoimmune hepatitis. We haven't looked at herbal medications in a lot of in autoimmune hepatitis yet, but have looked at it a lot in the fatty liver world. And so there are some that are showing some improvement in liver enzymes, some studies that conflict, so some studies that say yes and some studies that say no. So this just highlights that there can be some that could be helpful, especially in the future with more testing in the setting of some inflammatory liver diseases. Two other herbal or dietary supplements that we get asked about relatively frequently in addition to the milk thistle would be turmeric or curcumin and vitamin D, and turmeric is very commonly used, especially in India. It's a common additive to food and for seasonings, and then vitamin D. There has been some research into vitamin D in the autoimmune hepatitis realm, so it's been associated with, if you have a vitamin D deficiency, it's been associated with higher liver inflammation and fibrosis in adult autoimmune hepatitis, but no studies have looked at it to improve inflammation or decrease fibrosis or scarring in autoimmune hepatitis. And so we know that vitamin D deficiency could have worse liver inflammation in autoimmune hepatitis, but we don't know that it helps if you supplement vitamin D, but it is important for bone health, so vitamin D is very safe and we use it as a supplement. And turmeric or curcumin is an antioxidant. It's currently being studied in other autoimmune diseases such as rheumatoid arthritis, diabetes, ulcerative colitis, which is an inflammatory bowel disease, and there was a meta-analysis which looks at a bunch of studies in 2018 and showed it was not superior to a placebo, meaning a no medication, for remission of ulcerative colitis, so it did not help in the setting of that autoimmune disease. But it is actively being looked at in some autoimmune diseases, not yet autoimmune hepatitis, but curcumin, despite its popularity for other autoimmune diseases, has actually had some reports of liver injury, so it's not one we commonly recommend in the use of autoimmune hepatitis or liver conditions. It's probably not the true curcumin we use for spicing and things that causes liver injury. It's actually those curcumin or turmerics that are more herbal and dietary supplements, because the way that manufacturers make those is they actually increase the bioavailability and add other things to them. And so it's much more potent than what we would typically use in cooking and what has been used previously for herbal treatments. And so it's likely those higher dose or higher bioavailable curcumins and turmerics that actually can harm the liver and cause almost like an autoimmune hepatitis picture in some patients. So the Drug-Induced Liver Injury Network actually also looked at a lot of these herbal medications in their liver injury network, and they found that about 20% of all liver injury cases in the U.S. actually come from herbal and dietary supplements, most commonly being the chart at the right, bodybuilding supplements, and then weight loss supplements. Miscellaneous includes things like turmeric and other herbal and dietary supplements that can't be categorized to the above. So they cause a decent amount of liver injury cases we're seeing within the network. Why can these plants and herbs be harmful? So we talked a little bit about the high bioavailability and and some of these plants being used for thousands of years, and if millions of people use them, 40% of people in the United States, but we don't hear that much about them causing liver injury unless you're a liver doctor. Why do they sometimes cause it, and why do they not? We don't know exactly, but there are likely patient, environmental, and drug-related factors. So we already talked about one of the drug-related factors being that there are more potent forms than occur naturally. Also, sometimes when people are taking these medication or supplements and using them, they kind of think, well, it recommends one pill for weight loss. Why don't I take 3 pills? Because 3 pills has to be better than 1 pill for weight loss. And so often they're used kind of not with the recommended amount. And then often, as we talked about, not everything is on the label. And so you're getting exposed to things that aren't necessarily labeled on the drug and may cause harm to your liver or other parts of your body. And then often herbal medications and dietary supplements can interact with other drugs you may be on for your liver. If some patients are on tacrolimus, there are a lot of herbal medications that can interact with tacrolimus and affect the levels of those drugs. And so it's important to know about drug interactions. There are also environmental factors, so already having inflammation, having infection, drinking alcohol, smoking, those things, hopefully not in our pediatric population, but as kids get older into teenagers and young adulthood, some of those things may occur, and those can increase your risk of being harmed by some herbal medications or dietary supplements. And then age, gender, having obesity or what we call metabolic syndrome or diabetes, and then underlying liver disease can predispose you to having more injury from these herbal medications. So all that to say, are these herbal and dietary supplements helpful or harmful? The answer is yes and no, and we always need more information. So what are some practical tips if you're wondering if there's something you can use as an herbal or a dietary supplement to help your child with liver inflammation, or even in general symptoms of sometimes that are caused by autoimmune hepatitis? So my usual recommendations are ask trusted sources. So talk to your liver doctor, and then look at trusted sources like the NIH. There's a liver toxicity database where we list drugs, and it tells us drugs and herbal medications, how often they may cause liver injury. We compile reports of those. And then there's also the NIH Office of Dietary Supplements online, and you can get a lot of good information there regarding if supplements are known to cause liver injury as well. And then I would also recommend, if you're going to use an herbal or dietary supplement in yourself or your child, that you use according to instructions and do not take more than recommended. And then obviously if you start seeing symptoms, stop taking the supplement if there are unexpected symptoms. I feel like the most frequent one I probably get asked about is vitamin E, milk thistle, less common curcumin. I do have a few patients who take milk thistle. I recommend that they get it, the purified version, making sure it's monitored strictly from a well-known company. So usually I recommend kind of the larger companies. If they're selling a supplement that has a lot of additives to it that's caused a lot of harm, they're not going to be selling that supplement anymore, because those companies don't want to be selling things that are harming their patients. So I usually recommend not buying it kind of randomly, but looking at where you're buying your supplements from. Bring it into your liver doctor and let them also check and make sure. And so milk thistle, we don't have any studies that show it can benefit autoimmune hepatitis, but it's one of those that I usually say we don't have a lot of data that it causes harm, so it is likely not to be helpful or harmful. And then the same thing with vitamin E. We know there are some studies in fatty liver disease that it can slow progression of scarring. We have not studied it in autoimmune hepatitis, but it is a really relatively safe and tolerated medication. So vitamin E could be one that I would be willing to let some of my patients try if they were interested. So that is all for herbal and dietary supplements today. We'll be moving on to food, fat in the liver. So I feel like I often get asked about, are there good and bad foods for the liver? What should my child eat when they have autoimmune hepatitis? Are there things they can eat to decrease inflammation in their liver? So most of what we know about diet and the liver comes from our research in steatotic liver diseases. So that's previously known as fatty liver disease. Steatosis means fat. And so that is now the most common liver disease in the world. So the steatotic spectrum of liver diseases, and that can range from just fat in your liver that's not causing inflammation, or fat in your liver that causes inflammation, which is called steatohepatitis. And then also eventually, with a lot of inflammation, can cause liver scarring and result in cirrhosis. And we know there are many factors and risk factors for steatotic liver disease, which are listed to the right. So diet plays a big part. Drinking alcohol can play a big part. Having diabetes, or what we call insulin resistance, not having an active lifestyle, high fats in the blood. There are a lot of things, and also some genetic things that can go into having fat in the liver and make you more at risk. Overall, studies estimate excuse me, that the overall prevalence globally for children with steatotic liver disease is around 10%. And then a study specifically in children with obesity shows that there's a higher prevalence, and a little bit more in boys. About 30% of steatotic liver disease in children is in boys, and then 24% in girls. And then there's also a strong association with steatotic liver disease and obesity, but about 5 to 10% of steatotic liver disease can be in lean individuals, so without obesity. So it's still something we think about, especially if you have another liver disease. We don't want you to develop steatotic liver disease on top of your chronic liver disease that can worsen inflammation. So what do we know about steatosis, or fat in the liver, and autoimmune hepatitis? There have been a few studies in the last 5 to 10 years that have shown higher level of liver enzymes and IgG, one of the markers we use kind of for inflammation in the body in the setting of autoimmune hepatitis and some other autoimmune diseases, after treatment, and they're can be more likely to have advanced fibrosis at presentation compared to just having autoimmune hepatitis alone. So if you have both steatosis and autoimmune hepatitis, you tend to have more fibrosis or liver scarring when you present with your autoimmune hepatitis. And then there are actually a few mouse models in research labs that show increased inflammation in autoimmune hepatitis mouse models with steatosis. So having steatosis and autoimmune hepatitis can cause more inflammation in your liver and could potentially cause more scarring in the liver. So what can we learn about diet and the liver from this steatotic liver disease? Currently, there is no recommended diet proven to treat autoimmune hepatitis. That I will preface before we go into more about diet by saying that, but we're learning what we can from the steatotic liver diseases about diet and autoimmune hepatitis. So currently, the Western diet, or the diet in a lot of the United States, is very high in fat, sugars, added salts, low fiber and vitamins, and so we have a lot of prepackaged foods, refined grains, red meats, processed meats, those really high sugar drinks that everyone loves because they taste really good, and kids love because they love juice and sodas, and often sweets and things like that. And then we have a lot of processed or ultra processed foods, and so those are foods that have typically undergone a biological or a chemical physical process to improve texture, taste, shelf life, so they make you want it more, and they also make it last longer. And those have even higher fats and added sugars, and they don't really contain a lot of nutrient value, and so little to no whole foods. So those are things like chips, hot dogs, chicken nuggets, a lot of things over on the picture on the left that we know taste really good, but don't really have a lot of those whole foods that provide nutritional value. And actually, the National Center for Health Statistics looked at these types of foods and showed that they contribute to about 25 to 50% of the daily energy intake in the U.S. and Canada. So that's most of the Western diet. And so why do we have all these processed foods, and how does that relate to chronic diseases and inflammation? So as we have evolved as humans, our food processing procedures have also evolved and allowed us to develop combination of nutrients in foods that weren't previously encountered during human evolution. You know, caveman days, they had fruits and vegetables and meats pretty much. And so as we have evolved, our food processing has evolved. So we have those processed and ultra processed foods. We're making them last longer. We're making them more palatable, but we're not making them as good as whole food nutrition. And the Western diet, these processed foods have been linked to inflammation and actually been linked to the increase in a lot of chronic diseases, such as increased obesity, increased diabetes, increase in cancer risk, and cardiovascular diseases, so like coronary artery disease and heart attacks. So high sugar, more specifically fructose, is associated with increased fat in the liver of mice models, adults, and children. And so this has been well studied in the pediatric fatty liver world. And so even in the mouse models, we know that diets high in fructose, which is a monosaccharide typically derived from fruits. Not to say that fruits are bad, but we take fructose from fruits or derive it and make it into kind of a sugar additive. So high fructose corn syrup is one of those things. That is one of those processed sugar additives. We use it as a sweetener. We put it in a lot of the ultra processed foods, carbonated beverages. And so increased consumption of fructose in a lot of these processed foods has emerged as a major contributor to this steatotic liver disease, which results in inflammation, has also been a major contributor in things like the cardiovascular disease and diabetes and insulin resistance. And so we have actually had some studies that has proven that increased fructose in kids has been linked to increased fat in the liver, even as young as infancy. So there have been associations with intake of sugar-containing beverages in infancy with increased liver fat accumulation in those kids once they enter school. And so that was a study in 2020. So why does fructose cause increased fat in the liver? So fructose is actually one of the sugars that's mainly metabolized by the liver and then some in the intestine, and it actually increases lipid synthesis or lipogenesis, so making of fats. It increases that in the liver, and so it just promotes the liver to make more fat. So that's kind of why the high fructose diet causes more fat in the liver in these mice, these kids, these adults. So what do I typically recommend is a healthy liver diet when I have a parent ask me, what can I do diet-wise to help my child and their liver? My general statement is a healthy diet. What I consider a healthy diet is a diet that's high in fruits and vegetables and whole foods. So increase those fruits and vegetables and whole foods, which I know sometimes can be challenging in kids, especially toddlers. But I say just keep trying, showing them new foods. Some of the recommendations I usually make is have them go to the grocery store with you and help pick out a new food they want to try, a new vegetable, a new fruit. I also know that fresh fruits and vegetables can be very expensive. When you're trying to be healthy, that is very expensive. And so even frozen fruits and vegetables are relatively equivalent to the fresh fruits and fruits and vegetables. So I encourage families, they last longer frozen. You can do some more things with them, put them in smoothies, put them in ice creams, let them melt and your kids to eat them. So even frozen fruits and vegetables are better than those other kind of high saturated fats, ultra processed foods like we typically see kids wanting to snack on a lot. And that's not to say we should limit kids from ever having chips or brownies or candies or things like that, but we really should limit their exposure to those things and promote more healthy eating. I pretty much have a blanket statement when I talk about diet that says no sugary beverages except for the occasional treat, at a birthday party. Now, if you're going to a birthday party every day so you can get soda, that's probably not the best idea, but I usually counsel parents and kids on the easiest thing is to kind of cut out those drinks with sugar, because we know those drinks with sugar have that high fructose corn syrup. They have that high sugar content, and that sugar likes to go straight to the liver and cause increased fat in the liver. So it's just safer for your overall health and for overall liver health to just not have those added sugars. So my usual rule of thumb is a drink has no calories or has less than 10 calories. That means it's typically sugar-free or low sugar. So some of the alternatives I recommend are like the Crystal Light packets. Those are usually low in calories. Some people ask about diet or like sugar alternatives. There is some newer data coming out that maybe sugar alternatives, conflicting conflicting data that they could cause some other chronic health illnesses. I usually don't recommend other sugar, like alternative sugars or sweeteners, just because they tend to just increase your sugar craving. So when you have the sugar alternatives, that usually just makes you want more sugar. So it doesn't usually help you limit things that are high in sugar in your diet. So these are my general tips and tricks for families when we're talking about what is healthy for a healthy liver. And then one of the newer diets that is getting a lot of traction in the liver world with steatotic liver disease, and also in more of our inflammatory bowel disease world, which is another autoimmune GI condition we see a lot, is the Mediterranean diet. It's actually now recommended in the treatment of those fatty liver diseases, because it is very high in whole foods and fruits and vegetables, omega-3s. It limits a lot of added sugar, and it's been shown to decrease fat in a lot of the fatty liver studies. And so the Mediterranean diet has not been studied in autoimmune hepatitis, but it is a very healthy diet that promotes decreased fat. It also promotes kind of decreased calories, which helps with weight loss, which also helps in those fatty liver diseases. And there are ongoing studies about the Mediterranean diet decreasing inflammation in the body. We don't have any good data that says that helps in autoimmune hepatitis, but it definitely can't hurt to focus on one of these diets. And I like to talk about the Mediterranean diet because it kind of has some general guidelines to follow that I think you can pick one or two things out of and start with one or two changes and slowly add that to improve a healthy lifestyle. Usually it's very hard to go from eating a very common Western diet that we all like to eat to completely changing to the Mediterranean diet. And so I usually say, just kind of look at the Mediterranean diet, see if there are one or two things you think you could incorporate, you think that your child may be willing to try in order to slowly start making those diet changes. One of the first things I usually recommend is changing your oil to olive oil, because that is one of the healthier oils over butters or vegetable oil or canola oil. So that's kind of a mainstay of the Mediterranean diet. And then the Mediterranean diet also talks about exercise and physical activity. And so I would be remiss if I didn't have one slide about physical activity, because that's very important for overall health and liver health. So the benefits of physical activity in children and adults, there are many. You get boosted endorphins, so it helps your mental health. It improves blood pressure and helps your cardiovascular health. It helps with appetite control and fat burning. So exercise is one of those things that will help you burn fat and calories, which helps decrease fatty liver disease. And overall, normally you get a good energy boost and it just makes you feel good. So I have gotten a little creative on what I say is exercise lately. Especially for kids, they're going to need to want to do it if they're going to do it almost every day. And so my rules for activity for kids are it has to be enjoyable. So if that is a dance party, if that is cosmic yoga on YouTube, if that is just taking a walk with the family, walking your dogs. I have some kids that I don't promote TikTok, but if they already have TikTok and like to do TikTok dances, I'm like, okay, do 5 TikTok dances every, 10 minutes for 30 minutes. And so whatever it is that makes your body move, makes your heart beat fast, makes you sweat, and you enjoy it, kind of get creative with your physical activity. And usually I recommend at least 45 minutes, 5 days a week for kids of an activity they enjoy that meets all of these requirements for general health and also for liver health. The last thing I'll talk about as we kind of wind down with time is adherence to medications. And my counterpart, Dr. Jaros Varaparan, kind of touched on this a little bit in his talk about outcomes for pediatric autoimmune hepatitis. But why is it important to take daily medications and how to improve when kids say they don't want to take their daily medications? So medication adherence, missing or stopping medications for autoimmune hepatitis is a common cause of autoimmune hepatitis flares in adolescents, honestly, and that is not unique to autoimmune hepatitis. It happens in a lot of my adolescent patients, no matter what their medical diseases that they may be taking medications for, even in my transplant patients. And so studies estimate that 10 to 89% is a very broad range of non-adherence with medications in teens. There's in various chronic medical conditions. So a lot of studies show that it's a pretty prevalent problem in especially our teenage population. Sometimes we also have younger kids who don't like to take their medications, and that's more so they might not like the taste or things like that. Not so much as most of my adolescents just are like, I don't want to take it because I don't want to do it. And that's a common thing for teens, I feel like, as being a little rebellious in their teenage years will do. But what are some reasons for non-adherence? So sometimes it's fear of medication side effects. What is this medicine going to do to my body? When I start to understand more about my underlying liver disease or what that medications have side effects, especially things like steroids that we use a lot in the autoimmune hepatitis population. One study also shows that patients and families forget about 50% of the information that a provider may provide at a 15-minute meeting with a physician. And so maybe we're just not enforcing things enough sometimes, or maybe we're giving you too much information all at once and a teenager's overwhelmed about the importance of needing to take this medication. Concerns about medication effectiveness. So maybe they feel like the medicine's not working, or towards the bottom feeling well, they feel like you've made me better. I don't really need to take a medicine again. And I feel like that happens a lot with my adolescent patients. They don't understand why they have to take a daily medicine when they're feeling well. And so that kind of falls back on us as physicians and us as parents as well, kind of helping them understand the importance of why they have to take their medicines every day. And then also, sometimes, especially in hard to treat autoimmune hepatitis and other chronic diseases, the pill burden, the amount of pills you have to take can be large, and that can be very overwhelming for any kid, and they just don't want to have to take that many medications, and it feels like a job. And sometimes it is, but I think as physicians, we have to think about what we can do to help, or why our patients may not be taking these medicines. So what are some of the things what we can do as patients or parents and as physicians? So as physicians, we can work to simplify medication regimens. So always asking your child's physician, do we need to be on all these medicines, or maybe how long, or is there a smaller number of medicines we can be on, or are there alternatives? And then us providing education on medication side effects, written and verbal, since may not remember everything we say in an office, especially myself. I know I'm a fast talker, and so I know some people may not remember everything I say during an office visit. And when you have a chronic disease and there are a lot of things that go with that, sometimes it can be overwhelming to remember everything we talk about. We do this every day, and so it's kind of easy for us to just rattle off a list of things. But when you're learning and new to a disease, it's important to educate yourself and be provided that education. And then making sure we're renewing medications regularly, being aware of financial costs. There's some medicines we use that can be very expensive. For example, azathioprine can be relatively inexpensive, but if we'd have to change to mycophenolate or MMF, that's much more expensive than azathioprine. So being aware of the price differences in medicines, can we work towards cheaper alternatives so that families can afford some of these medicines if they're not getting a lot of help from insurance? And then making sure the kids we take care of and parents understand the goals and the treatment plans, why you're on that medication, why it's important to your health. And I think that's very important for all of our kids to talk about, but especially those approaching their teenage years, before they kind of start thinking, I feel better, I don't want to take my medicine. I try to be a little proactive in that, making sure they understand why it's important, even if they feel well. And then what can patients and families do? Incorporate medicines into daily routines. So same time every day, breakfast, dinner, brushing your teeth, having a medication calendar you mark off. Nowadays, almost every kid has a smartphone, so there are apps for that, as I like to say. So using an app to remind you to take your medication. Or I'm a little old school, visual reminders. I just write on my mirror so that I see it every morning, like take your medicine, so that it is a prompt to remind me. Set an alarm. Have an alarm every day in your phone that goes off, that's repeated, that tells you to take your medicine. And then parents and teenagers, and as we approach adulthood, when we're trying to have our teenagers be what we call more autonomous, often want to kind of say, it's your responsibility, it's your medicine. And for some patients that works great, but for some kids that doesn't work very well. And I'm always supportive of, of teenagers, especially those getting close to adulthood, having more autonomy. But we also have to remember that if they're not able to do that yet, being the supportive parent and being there to remind them until they are ready to kind of take on that responsibility, or slowly giving them that responsibility, is the best. And so not just kind of saying, oh, you're 17, 18 now, you just get to take over all your medicines. We may have to help them along a little bit more for a little bit longer, as parents. So how do you keep your liver healthy? Summary for this talk today. Discuss herbal and dietary supplements with your hepatologist. We may not say everything is off the table, but we want to know what you're taking. It's very important for us to know what you're taking, especially in the setting of liver injury with some of the herbal and dietary supplements. We may see that your liver enzymes are up, but you're like, I've been taking my medication, but oh yeah, didn't tell your doctor about taking that green tea extract weight loss medication or something like that. So it's very important to discuss any herbal and dietary supplements with your hepatologist. There's no diet to treat autoimmune hepatitis, but a healthy liver diet is low in sugar, processed foods, and saturated fats. So it's important, to kind of start that early, make it the norm for our pediatric patients and families, eating that healthy diet and limiting those high sugars or not having those sugary beverages and limiting those processed foods. Exercise is important for liver health, also for cardiac and mental health. And then taking prescribed medications is important to keep inflammation under control and limit worsening of liver disease. And that is all I have today. So if you have any questions, I know that was a lot of information about how to keep your liver healthy, but if you have any concerns, talk to your liver or your GI doctor. We're always happy to give education about how to keep your liver healthy.
Age do you guys start talking to teenagers and preteens about, earlier than alcohol, things like that, and things that are essentially off the table?
Yeah, so, it's funny. I have some parents that ask super early. I think I had a dad last year when I diagnosed the kiddo with AIH. The kid was 7, and he's like, but what about when he goes to college? Can he not have alcohol? And I'm like, and I wasn't at the talk earlier, so I'm not sure what they talked about. I pretty much have a no alcohol policy, but that's more because, it can lead to things you don't know, how much is too far. 1 to 2 drinks, maybe occasionally is okay, but continued use of alcohol is definitely going to cause liver harm and can deposit fat into your liver. And so I usually kind of assess maturity level in a lot of my patients. So I'm always telling parents about it, in the future, no alcohol, healthy diet, but usually around that 12 to 13 age, kind of when kids are entering adolescence and becoming an actual teen, is when I start kind of assessing I call it sex, drugs, and rock and roll talk. So when we start asking parents to leave the room and we start talking about those things like their pediatrician would also be doing, but what's important from a liver standpoint. So what do you know about alcohol in your liver? What do you know about medicines in your liver? And then that's also when I start talking about kids learning what medicines they're on in preparation for that time that they have to go to the adult world. Because as pediatricians, we not baby our patients, but we're very, hands-on with a lot of our patients. In the adult world, it's a little bit more of you take your medicines, that's your responsibility. Whereas in kids, we're, really doing a lot of things to get you to do the healthy things, and we're talking to your parents, and you have your parents there to watch you. But eventually, your parents aren't going to be going to your appointments with you, so you have to understand the importance. So I usually start having those talks or assessing kind of at what level I can have those talks around 12 to 13. Yeah, good question. No, it's okay.
So, for instance, we're over 2 years in, and my son has recently started saying, I don't want to take my medicine. Obviously, we still do, but it has become more of a fight, and he's so young, I guess. Do you typically see that continue to get worse until adulthood, or does it kind of come and go? Is it just burnout?
Yeah, I think it's probably a combination of all the things. So the question was, sorry for the online recording if you can't hear, if kids at an early age start saying they don't want to take medicines, like I'm tired of taking my medicine 2 years into taking it every day, does that get worse or better? And I think it kind of depends. I think addressing it early is, sometimes I like call it out. I'm like, yes, it sucks to take a medicine every day. I can relate to that. I take medicine every day, and like my husband makes fun of me because I have a whole pill box just to take vitamins and medicines and things like that. So I kind of call it out and say, yes, it sucks, but here's the reasons it's important. And sometimes you kind of got to bring it down to the level. Well, you feel pretty good right now. You may not remember how you felt before this medicine. If we don't take the medicine, kind of got to relate to their goals. What do they want to do? Are they a kid that's in a sport? Are they a kid that likes to do certain activities? So I usually kind of say, what do you like to do? Play video games. Okay, well, if we don't take your medicine, that may cause more inflammation or harm to your body, and you may not feel good enough to play a video game. And so sometimes if you can think about what your child's goals are and feeling better and how they feel now, you can kind of say, if we don't take these medicines every day, then we may not feel good enough to do the things we like to do. And so sometimes I'm able to kind of get through to them. And some days they may be like, it sucks, I don't want to take this today. And and then sometimes I'm like, that's when we got to put in our big parent pants on and be like, okay, I know, but we're doing it. And sometimes that sucks as a parent too. But I think them understanding why starts early. And I do think that usually early on, if we stress the importance enough and get kids to buy in on why it's important and focusing on the things they want to accomplish, and the medicine is helping them get there, then later on it's usually less of a problem in the teens. If I've had a kid that's doing well and then at 15 they stop taking their medicine and they're like, well, I feel better. I just, I decided I didn't want to take it. So I feel like most of the time the kids who stop it in their teenage years, interestingly, aren't the ones I had a problem with early on. So maybe that'll be a good thing for for your son. You're welcome. All right.